You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour. Well, good morning, everyone. I hope that you are nicely dressed this morning. It is cold outside. Want to say good morning to our listening audiences of WMPR 90.1 FM, WFQY 99.1 FM, WGDQ 93.1 FM, and our YouTube channel listeners. Good morning, good morning. Now, don't forget what I told you at the top of the show last week. I received notification that starting December 1st of last year, all U.S. phone carriers began blocking unregistered SMS messages. That's text messages. And this pertains to small businesses and organizations as well, but not to individuals. Okay, so they're not going to be blocking your text messages. It just pertains to small businesses and organizations. Now, I don't know what to believe because our business line has still been receiving text messages. We got some last night and this morning. Several of you like to text me while I'm on the air, and I love it. Well, the only thing constant is change. And so I thought that as of December 1st, you would no longer be able to text our number, 601-714-8378. That's 601-714-TEST. The regulation correspondence that I received stated that I could actually keep receiving the text, if I registered for something called the Campaign Registry, TCR, brand campaigns. Go check it out. And there's a one-time fee, $15, and it's a recurring monthly fee. And trust me, I, nor Test Taking Solution, nor our foundation can afford yet another subscription monthly fee. My goodness, especially for anything that we do not necessarily need. And that's the message I send back to them. Well, as I said, for right now, it looks like we're still able to receive your texts. God knows that I enjoy receiving them. And so you can check out that new industry regulation that's being mandated, all in the name of protecting consumers. So I do get that. But just to be on the safe side, if you want me to receive a message from you while I'm on the air, go ahead and text it to me. If I receive it, you'll know because I'll acknowledge it publicly on air, as I usually do, without calling your name, of course. Now, if you want everyone to know your name, call in and share it. Tell everybody. If you do not hear me acknowledge your text after 2 to 3 minutes, then consider that an indicator that I didn't receive it. And then you can go ahead and email us at founder@ttsfoundation.org or go to our contact us page, as many of you do, the contact page of our website, ttsfoundation.org. Either my staff or I will see your message and most likely respond to it again while I'm on air, if time permits. And don't forget, you can always call into the show. The call-in number is 601. That's for the SIP. 714-8378. Well, it's Health Literacy Tuesday here on the Literacy Hour. The information shared during the Literacy Hour, either by the host, that's me, or a guest, and we're going to have a wonderful guest today. I'll tell you all about him in a moment. But it's for educational purposes, and it does not constitute medical, legal, financial, or tax advice. For specific advice applicable to your situation, please contact a licensed certified professional, preferably one with whom you have a relationship. Remember, relationships matter. Thank you again for joining me this morning. Be careful on your commute into work or wherever your travels may take you. My small business, Test Taking Solution LLC, tutors kids, okay, and provides an array of professional development and management services, and we enjoy doing so. Our foundation's mission is to mitigate health disparities. And one way we do this is by enhancing literacy. Thus, the purpose of this Literacy Hour broadcast. I like to remind everyone of that at the beginning of each year. You know, we've been on the air since November 2022, and we are so blessed to have lasted this long. Research on the causes of health disparities has been emerging in recent years. It certainly has caught my attention and the attention of a lot of other healthcare professionals. There are some populations of people like us, Blacks, African Americans, who are more susceptible to risk factors that are shaped by multi level, multi domain influences, if you will. Things such as discrimination. Yeah, it's real. Economic status, access to transportation and affordable housing, education, public safety. Um, I'll be with Police Chief, and that's JPD, Jackson Police Department. Jackson's finest. We'll be with Police Chief Wade tomorrow on his podcast, and I think that airs at 11 a.m. He and I will be talking about some things that are going on here in the community. That's tomorrow. But other multi-domain influences include language, cultural barriers, and the list goes on. Okay, but collectively, these are known as social determinants of health. Yeah, these things impact how healthy a person can become or their chances to have optimal health. Sometimes people refer to these as social drivers of health. These multi level social factors that impact human health. Um, they help to explain population based differences in healthcare based screening, surveillances, and treatment. So it's important that we know what they are. They are population based differences in healthcare access. I said it, and it's true. You can do all the research you want to do, and you're going to come to the same conclusion that there are population based differences in healthcare access, in healthcare utilization, and in healthcare literacy. These differences underlie why we have health disparities. In the vision field, for example, factors causing health disparities may interact with one another to affect vision health disparities. Have you ever thought about that? Vision. You know, God gave us two eyes, and they're so very, very vital to our very existence. We just have two of them. And there's a nerve that runs to the back of each of those eyes. It's the same nerve, it's the optic nerve. And we have to make sure that that nerve is healthy. So we have to get regular visual eye exams to make sure that we're focusing on our eye health as well. So, some of these health disparities that interact with one another could be on individual level. Factors might include your occupation, the type of work that you do, or vision health literacy, awareness. Interpersonal level factors that might include how your family thinks about eye care. Yeah, family beliefs impact eye care. Household instability, or working non traditional hours that limit time for regular eye exams. There are some community level factors that may include exposure to environmental hazards, such as pollution and poor lighting. I thank God that Highway 18 is getting lit up. Have you been over there lately? My goodness, it's looking fantastic. I want to thank God for Hinds County Board of Supervisor Wanda Evers for leading that charge, and her colleagues who are supporting her in the efforts. We got light over in that end of South Jackson now, and it is beautiful. So, community level factors impact health disparities. And in particular, what we're talking about right now is vision health. So, pollution, poor lighting, neighborhood violence that deters people from accessing care. You don't want to go to a clinic in a neighborhood that's crime infested. Access to healthy foods is another community level factor that impacts health disparities. And then there are some societal levels. So we've talked about individual level, interpersonal level, community level, and there are these overarching societal levels of factors that include things such as inadequate public transportation or healthcare policies that limit affordable eye care access. We can't go get our eyes checked if we can't afford to pay for the exam, if we don't have transportation to get to the clinic appointment. Okay. These factors may affect individuals' ability to maintain healthy vision, and they certainly contribute to vision health disparities in particular and health disparities in general. Now, having mentioned the community level factor of access to healthy foods reminds me to let you know that later on in this show, we are going to have a special guest to stop by the studio, Mr. David Penny of Sysco. Boy, that's my favorite food distributor. I don't know about you, but when I was growing up as a little girl, man, I enjoyed seeing that Cisco truck parked outside of our elementary school. My mom was a cafeteria manager. Yeah, over in Noxubee County. He was a cafeteria manager for many years, and we would have to get to school really, really early. So, of course, the Cisco trucks would be there, and man, they never missed a beat. And the food was fabulous back then. It was so tasty. Some of you remember? I remember we used to have warm donuts for breakfast and milk. But Mr. Penny is a produce, that's fruits and vegetables expert. He comes highly recommended, and I can hardly wait to learn something about leafy green vegetables that perhaps I do not know, and I can't wait to learn it directly from a professional of his caliber. So please stay tuned to hear from Mr. Penny later on this morning. The phone line is open, and I welcome your questions and comments. You know I do. 601-714-8378. And Mr. Penny, he's not going to shy away from your questions either, and we've already talked about it. And you can visit our website too. Again, that website is ttsfoundation.org. If you go there right now and click on the Literacy Hour page, you'll find the link to our live stream. Just scroll down until you see the Literacy Hour channel, click it, and you'll be able to go back and listen to any part of this show that you like. But don't just click it, please subscribe to it. And that way you'll be notified whenever we're on air. And I can promise you, when we're on air, it's because we have something to share. Okay? That rhymes, doesn't it? When we're on air, we have something to share. I love it. Welcome to the Literacy Hour, everyone. Let me share a few announcements. We got some exciting news, and I wanted to share this one last week during Education Literacy Tuesday. You know, today is health literacy, right? But last Tuesday, I wanted to tell you that that Mean Green Marching Band at Mississippi Valley State University has been invited to play in the inauguration parade for President-elect Donald Trump. Isn't that an honor? Man, I love it. Boy, that Jackson State band just showed out in that Rose Bowl parade, and now here we go with the Mean Green Marching Band getting ready to show out in Washington, D.C. for the inauguration parade for our president-elect, Donald Trump. I remember Mississippi Valley State's, what is it, Green Devil Marching Band so very well as as a kid, I was a drum major in Noxubee County from 5th grade all the way to 12th grade under the tutelage, the direction, the leadership of Billy C. Dixon, the late Billy C. Dixon. I gave him the name Chief. Yeah, I coined that for him, Chief. And I'll never forget it when I graduated from high school. I gave my valediction and I was the star student just by God's grace. You know, that means that I made the highest score on the ACT there at that time. But anyway, when I got done getting those accolades and giving that valediction, Chief came up and he was my star teacher. Right, because he had been with me since 5th grade. I could have chosen my chemistry teacher, my physics teacher, my algebra teacher, my calculus, pre-calculus teachers, any of them, because they were all absolutely phenomenal. Man, Noxubee County was kicking it back then. I'm sure we had an A level, MDE, Mississippi Department of Education rating if they were giving them out back then. I don't think they were, but had they been giving them out, man, we would have had an A, probably A plus rating. That's just how bad our school district was. I miss being in those classes with those wise teachers a lot. I think about them often. But anyway, Chief stood up, and I'll never forget it. He announced his retirement. Yes. He announced his retirement on class night, the night I gave my valediction speech. And he passed away a few years ago. And of course, it hurt me tremendously because I think I was in residency at the time. And I didn't find out that he had passed away until days after he had been buried. And it man, it hurt me to no end. I don't think social media was as widely used as it is today. Had it been, I would have known about it immediately, but it bothered me for many years that I wasn't able to say goodbye to him. But I did find out where he is buried, and I have paid my respects. Rest in peace, Chief. Well, President Trump and Vice President elect J.D. Vance will take the oath of office on Monday, January 20th, 2025. Very special day for me as well. That's the day I gave birth to my son, Joshua. Well, our president will be taking his oath of office that day in Washington, D.C., and the parade will follow. You know, my eyes are going to be glued because I mentioned that Green Devil band in the context of me being a drum major at Noxubee County High, because Chief would take us every summer to a summer camp, a band summer camp at Mississippi Valley State. I will never forget those days, some of the best days of my life. And man, Mississippi Valley treated us high school students so very well. I learned so much from the drum majors. It was just a wonderful time of life. Haven't you ever wanted to just go back? Well, I tell you, things were simpler back then. But anyway, this is not just a moment of pride for our university, but for the entire state of Mississippi. Those are the words of Mississippi Valley State University President Gerald Briggs. He said that in a news release, along with these words: "It is an opportunity to showcase our legacy, celebrate our culture, and invest in the future leaders of our community." On December 26th, the band posted a GoFundMe with a goal of $350,000. I have to check on that to see how that's going. The band is seeking funds to acquire instruments, uniforms, provide scholarships, and get other essential resources for its continued development. The page for the fundraiser shared that with us. And so it also said the school was working to improve band practice facilities for its approximately 250 membered band. Congratulations, Mean Green Marching Band of Mississippi Valley State University. In other news this morning, Walmart is asking customers to discard recalled chicken broth. Yep, you heard it right. If you got some chicken broth from Walmart, Walmart says throw it out. Okay, Walmart says customers should throw out a chicken broth product that was sold at stores in mostly southern states late last year. That includes us. Walmart says that we need to throw it out now. The retailer has recalled 48-ounce cartons of great value family size chicken broth that had been sold at 242 stores in 9 states. The U.S. Food and Drug Administration reported the recall in December, affecting just over 2,000 cases of broth with a shelf life lasting until March 2026. The FDA said the containers had packaging problems. Okay, so there were some packaging problems with the containers, and that could lead to the broth actually spoiling. Okay, but there have been no reports of illness. But if you brought some chicken broth, and it's the Great Value brand, okay, not Campbell soup. Don't throw out your Campbell soup, please. No, but that Great Value brand, go ahead and discard it. Walmart says anyone who purchased a product at stores in Alabama, Arkansas, Georgia, Louisiana, Missouri, Mississippi, Oklahoma, Tennessee, or Texas should not consume the broth and can ask for a full refund. So wait a minute now. Do y'all want us to throw it away, or do you want us to bring it back to Walmart to get a refund? I don't know. You can also carry your receipt too, I'm sure. But either way, if you want to get a refund for the soup, show back up at the store, the Walmart in which you purchased it. Or if you don't care about getting the refund, just throw the soup out. The Great Value brand. The company said it's working with the supplier to investigate what could have happened. So I'm excited about that. And I'm happy that they have launched an investigation. We have to know about things like that. Thank you all for tuning into the Literacy Hour. This is why we do what we do. We want our people to be informed. It's tax season. Free tax filing assistance is available. I said free. Tax filing assistance is available for low and moderate income households through the Internal Revenue Service. You see, the IRS is not all bad. Some people get so afraid and all shaken up when the IRS comes calling. Listen, they put out a lot of great programs that we should be taking advantage of. And I want you to be aware that you don't have to pay anybody to file your taxes if you are low to moderate income household. They have two programs. One is called Volunteer Income Tax Assistance, VITA, and the other one is Tax Credit for the Elderly, TCE. So VITA and TCE. Let me tell you a little bit about both. Volunteer Income Tax Assistance, that's VITA. It was established over 50 years ago. VITA offers free tax help to individuals who earn $67,000 or less annually, okay, have disabilities or possess limited English speaking skills. So either of those, either you make $67,000 a year or less, you have disabilities, or you possess limited English speaking skills. IRS certified volunteers, they've been through training. They can assist with basic income tax return preparation and electronic filing. These volunteers, they'll ensure that your taxes are filed appropriately. They have, as I just stated, undergone rigorous training to ensure they're well versed in the tax laws, and they will maintain confidentiality. Okay, and that's so important to me when we're helping clients, even at Test Taking Solution, and even our scholars. You won't hear us sharing their names. Now, their parents and guardians and others can share their names all day and night. We may, put up pictures of us doing various things, but we like maintaining their confidentiality. And the same it is with this program, VITA. They're going to maintain the confidentiality of taxpayer information. Each tax return prepared at a VITA site undergoes a quality review prior to filing. Tax Counseling for the Elderly program, the TCE. Now, this program focuses on taxpayers age 60 and older, offering free tax help with an emphasis on pensions and retirement related issues unique to seniors. Like VITA, TCE services are provided by IRS certified volunteers. Again, people who have undergone rigorous training. They didn't just jump out here and say, hey, I want to volunteer to help with taxes. No, no, no. It doesn't work like that. You got to know what you're doing. And IRS is making sure of it. These are often retired individuals associated with nonprofit organizations, and they receive grants from the IRS. So the benefits of using either of these programs is cost savings. Both of the programs will provide free tax preparation services, and that eliminates the need for paid tax preparers. And then they provide expert assistance. The IRS certified volunteers are trained to handle various tax situations, and I'm sure they can get someone at the IRS on the phone probably much quicker than other folks, right? Because they've been trained by them. But they also, another benefit would be electronic filing. So I want you to know that if you electronically file your taxes, that can expedite any refund you might be due. So, accessing VITA and TCE services. Both of these programs operate through community partners at various locations nationwide, including community centers, libraries, schools, and shopping malls. But don't you go out there, trying to find one on your own. They have a VITA locator tool on the IRS website, and you'll be able to click there and find one, but you don't have to do that heavy lifting. Test Taking Solution has done it for you. We learned that there is a VITA and TCE service provider in our state, and it's called AJFC CAA Hazelhurst, and it's located at 133 West Gallatin Street in Suite 102. That's Hazelhurst, Mississippi. The telephone number is 601-894 4745. Again, don't forget, if you go to our YouTube station, you'll be able to play this episode back. And if you didn't get that telephone number the first time, you can play this episode back, and you'll get it written down for yourself. I'm so glad that you're tuned into the Literacy Hour, because by having done so, you get to learn about these services. And it brings me great joy to let you know that I have a team of professionals working at Test Taking Solution that I'll put up against any other professional team in this state and beyond. Mrs. Jasmine Newsom, CMA, is community outreach specialist, and she reached out to find out what the AJFC CAA stands for, because I asked her. I can't come to me with some acronyms, and I got to know what they stand for. She learned that it stands for the areas that the Hazelhurst site services: Adams, Jefferson, Franklin, and Claiborne. And CAA stands for Community Action Agency. So keep tuning into the Literacy Hour so that you can learn about other VITA CTE sites that may be available in Mississippi. Mrs. Newsom is staying on top of this for us. Okay, I've received an update from Mrs. Newsom. I was able, let's see here, to reach out to Miss Valerie with IRS customer service. She was able to confirm that the Hazelhurst location does offer services to the Hinds County area, even though the name of the agency is stated for those counties. For other projects that do not apply to VITA and TCE program, they are willing to help anyone in need of tax prep services. The facility will open on January 22nd to start taking appointments. See, I told you that she was amazing. And so are all of the other employees of Test Taking Solution. Thank you, Mrs. Newsom. I've been invited to serve as the guest keynote speaker at the Mother's Day program on Mother's Day at a church that's near and very dear to my heart, Belmont Baptist Church, where Pastor Tony Chrysler and his wife preside. I love the church for many reasons, a few of which include that it is a Bible teaching church. It cares about the community and shows how much it cares through its actions. It's always hosting events at its Immaculate Family Life Center, to which they invite the community. I'm looking forward to spending the early part of Mother's Day. That's 8:45 a.m. on the second Sunday in May. That's May 11th. at Belmont Baptist Church, located at 14011 Highway 18 West in Raymond, Mississippi. If you're at our foundation on Thousand Oaks Drive, you'll turn left onto Highway 18, pass through Spring Ridge Road, drive on into Raymond, pass Eagle Ridge Conference Center on the left and Hines Community College on the right, and you'll see the church on the left. Just go up to the light and make a U-turn. So I just want you all to pray for me and with me that the good Lord will guide me during my study of Holy Scripture so that I'll know what and how to share on that day. Um, see, if it was about me, I would have said no to the invitation because I'm not worthy. And I know I'm not worthy, but I learned a long time ago that God knows what He's doing. He's sovereign, and He may want to get a word to someone through me. Okay. If He can use a donkey, He can use me. Um, and so I dare not stand in the way of God's will. I plan to be there, and I hope you will decide to join me. Again, that's 8:45 a.m. on May 11th, 2025 at Belmont Baptist Church. I've already marked my calendar. Let me check to see if our guest speaker has entered the studio. He hasn't as of yet, but hopefully we'll be hearing from Mr. Penny here shortly. So while we wait on him to come in, I want to share some really hot topics in healthcare, right? WAPT Channel 16 did a very good job, I think, of covering what is being called a medical monster lately. They called it a quademic. Quademic. Listen, um, I'm so glad you're tuned into the Literacy Hour. We want to become more literate. Many of you already know that quad means four, the number four. So they called it a quademic, and they say it's hitting Mississippians left and right. They're seeing high numbers of four types of respiratory illnesses, and they are influenza, which we also call the flu, COVID, short for COVID 19, strep throat, and RSV, the respiratory syncytial virus. So there's a physician assistant working over at American Family Care Urgent Care. And when WAPT shared this information, the PA, the physician assistant, was sharing that they've been seeing a surge in respiratory illnesses this winter. But this year's influenza strain seems to be much more potent. They say they've been seeing more hospitalizations than last year. And they've also had more deaths associated with the flu this year, which last year they didn't see as many deaths. Guys, this is a wake-up call. Want you to be very, very cautious during this winter season. Space yourselves and practice social distancing. You want to not be standing right in someone's face and talking to them. Don't do that. It's disrespectful today, but it's also unsafe. Um, Wear your mask. If you're going to be in a crowded situation for any extended period of time, and everyone has their mouths open, and because that's how respiratory viruses are spread. Yeah, they're respiratory droplets coming out of folks' mouths, okay? And when they're sneezing and coughing, you want to protect yourself. And for those of you who don't like to see folks wearing masks, well, let me tell you, get over it, because you certainly going to see me wearing mine. I don't want you to catch something that I may have, so I'm going to mask up. So really, it's for you. So don't get mad at folks who are wearing masks. We're trying to be safe. Also, there are vaccinations for the flu, for COVID, RSV. There are vaccinations. And you want to learn all you can about those. We talked about them here on the Health Literacy Tuesday of the Literacy Hour. As soon as those vaccines become available, we let you know, because they work. I don't care, what people may say. Those who don't believe in vaccines, you're free and absolutely welcome to have your own belief. But you don't have to hate other folks who believe otherwise. And we need to stop all the hate. My pastor, Pastor Luke Epperson, preached on about love this past Sunday, and I really enjoyed the worship service at City Church. We also celebrated our 15th year anniversary, and I've been there since the doors opened. I tell you, it's amazing. My son was baptized 15 years ago on 10/10/2010, October 10th, 2010. So we celebrated the 15th year anniversary. Our church was jam packed. We had a wonderful, wonderful service, and he talked about love. So love yourselves, love your neighbors, protect yourselves. Respiratory illnesses are abounding, and you know, children can carry a lot of viruses, and a lot of other things. Okay, at school, help to teach your children how to cover their mouths when they're coughing or sneezing, and to wash their hands. Please wash their hands. Put a little thing of sanitizer in the book bags and just encourage them. They certainly know how to wash their hands at Test Taking Solution. They do so before and after they eat, but we are having them wash their hands now when they enter the center after school. So get in a habit of washing your hands. Um, well, we all know that Mississippi is well known for having some of the worst health outcomes in our country. Recently, Mississippi received another F, like we need another one. And this F is rating us on our preterm birth rate. Mississippi's preterm birth rate was 15%. That's our preterm birth rate. And that's the worst in the nation. I'm sick about it. Um, Preterm births, they were looking at our 2023 incidents of preterm births. And for those of you who don't know what preterm means, it's a birth occurring before 37 weeks gestation. You know, we tell women that they're going to go to 40 weeks gestation as a full term pregnancy. Well, sometimes babies are born before time, before they are medically um, determined or appropriate to be born. And that's the best way to put it. So if they're born before 37 weeks gestation, they are considered preterm. Anyway, the 2024 March of Dimes report card came out the middle of November. And here we are sharing this information. Mississippi's preterm birth rate, 15%. Any state with a rate greater than 11.5% also received an F. So we're not the only state that got an F, but you need to know that our rating was the worst in the country. The average preterm birth rate is 10.4%. And look at how far ahead of that we are, 15%. We can do better. Preterm births in Mississippi have risen steadily over the last decade, increasingly nearly 2% since 2013. Just steadily increasing year after year. Come on, everybody. We are Mississippi, and we can do better. In Jackson, the state capital, nearly 1 in 5 babies are born preterm. 1 in 5, according to that March of Dimes report. Now, you know, I'm going to always share reputable sources with you because I want you to be able to go back if you're particularly interested in topics that we discuss here on the Literacy Hour and review the report in its entirety for yourself. That's the 2024 March of Dimes report. Now, the interim chief medical officer at the March of Dimes, Dr. Amanda Williams, said that she knows the profound impact that comprehensive prenatal care has on pregnancy outcomes. And I agree with her. You know, as soon as someone realizes that she's pregnant, she should seek medical attention as soon as possible. Comprehensive prenatal care matters. Yet, too many families, especially those from our most vulnerable communities, are not receiving the support they need to ensure healthy pregnancies and healthy births. The health of mom and baby are intricately intertwined. And if we can address chronic health conditions and help ensure all moms have access to quality prenatal care, we can help every family get the best possible start. Now, in addition, I want us to be aware that in addition to inadequate prenatal care, there are some other factors that lead to preterm birth. Factors such as smoking, hypertension, that's high blood pressure, diabetes, the condition that some folks refer to as sugar diabetes, and an unhealthy weight. These can cause people to be more likely to have a preterm birth. So this same report reported some other metrics that you've heard our chief medical officer of the state Department of Health talk about, including infant mortality. And again, Mississippi continues to lead the nation. We're not happy about it, you all. In 2022 alone, 316 babies in our state died before their first birthday. One death of a newborn baby is too many. Among the babies born to black mothers, the infant mortality rate is 1.3 times higher. The state's maternal mortality rate of 39.1 per every 100,000 live births is nearly double the national average of 23.2. And Mississippi has yet to expand Medicaid, is one of only 10 states that has not done so. And tens of thousands of working Mississippians remain without health insurance. It also has not implemented paid family leave, doula reimbursement by Medicaid, or supportive midwife policies, and all of which the March of Dimes says are critical to improving and sustaining infant and maternal health care. But the legislature is in session, and perhaps they will take up some legislation that will impact the lives of our moms, our babies, and our families. Mississippi matters, and we're very smart people. We have excellent experts, and we're tired of making F's. Aren't you? Mississippi's law to provide presumptive Medicaid eligibility to low-income pregnant women remains on hold at the federal approval level. It's likely that the Centers for Medicare and Medicaid Services, that CMS, is requiring Medicaid to take out a proof of income and a proof of pregnancy requirement lawmakers included in the original bill. Federal guidelines state that while the agency may require proof of citizenship or residency, it should not, quote, require verification of the conditions for presumptive eligibility, end quote. CMS won't comment on ongoing negotiations with individual states. So if 2024 legislation can't be salvaged, lawmakers would have two options for rewriting the law this session. They could take out those requirements, those work requirements, which CMS has an issue with. Or they could take their chances hoping that a President Trump administration would grant a waiver allowing our state to keep those requirements, which again are at odds with federal guidelines. Something lawmakers will likely bank on with a Medicaid expansion bill this session. My fingers are crossed. An expectant mother would need to fall under the following income levels to qualify for presumptive eligibility. Presumptive eligibility income guidelines for a family size is just the pregnant woman herself, just the individual. The maximum household income she can make would be $29,216. A family of two, $39,654. A family of three, $50,091. Family of four, $60,528. A family of five, $70,965. A family of six, $81,402. Family of seven, $91,840, and a family of eight, the maximum household income that a pregnant mother, can make to be eligible for the pregnancy presumptive uh, income guidelines would be 102,277. These are the eligibility income guidelines for pregnancy presumptive eligibility. And to top all of this off, possible spending cuts to the CDC, Centers for Disease Control and Prevention, and HHS, Health and Human Services, could be looming and could negatively impact our esteemed Mississippi Department of Health. You need to know that people are talking about making cuts to the CDC and the HHS. Also, the possibly soon to be head of the HHS could really spell trouble for some of our state programs, like programs for chronic diseases, disaster relief, immunizations, rural health clinics, sexually transmitted diseases and infection testing and treatments, as well as the breast and cervical cancer early detection program that I speak so much about during the Health Literacy Tuesday, our Literacy Hour. I can personally vouch for the positive impact that the BCCP, that's the Breast and Cervical Cancer Early Detection Program, has had on uninsured and underinsured Mississippi women. That program provides access for mammograms and pap tests, diagnostic testing, clinical linkages, and navigation. More than 80% of our State Department of Health's funding comes from federal sources. Did you know that? In other words, our Department of Health's funding ratio is federally heavy. So there is no way that MSDH, or Mississippi State Department of Health, can accomplish the breadth of their mission without those federal funds. There's no way, unless more state support gets allocated to the agency. Now, having said that, it brings me great pleasure to report that on January 6th, okay, 8 days ago, CMS announced that 15 states were selected to participate in the Transforming Maternal Health. They call it TMAH, TMAH, the Transforming Maternal Health Model. And Mississippi is one of them. TMAH aims to improve health outcomes and foster a safe and supportive environment for mothers and infants enrolled in Medicaid and CHIP. CHIP stands for Children's Health Insurance Program. TMAH will provide access to care and resources to address individual physical health, mental health, social needs during pregnancy and during the postpartum period. Postpartum, for those of you not familiar with that word, that's for the time period after the mother has delivered. So it's after pregnancy, it's after birth, postpartum. The Medicaid agencies for each selected state will receive targeted technical support in three key areas: access to care, infrastructure and workforce capacity, quality improvement and safety, and whole person care delivery. TMA launched on January 1st of this year, and it will run for 10 years. So, help is on the way. Transforming Maternal Health Model. I can't wait to find out what all we learned from that, how effective it is, how beneficial it will be for mothers and infants enrolled in Medicaid. TMA. You can visit the Literacy Hour page of our website to find a fact sheet that we posted there, and it'll tell you all about the Transforming Maternal Health Model that's going to be running for 10 years. I don't see Mr. Penny yet, and so doesn't look like he has joined us in the studio. And when he comes in, I will certainly turn it over to him because I can't wait to learn more about green leafy vegetables. And he is an expert in the produce field. So we'll be learning from someone who knows what he's talking about. Hey, in the meantime, I still have lots to share. Okay. Let's talk about cancer and obesity. It's the start of a new year. And I certainly want to mention what the Surgeon General's advisory concerning alcohol consumption and its link to cancer has been all about. I know that you have heard, like I've heard, that there is a link and there's a reason for it. And I want you to be well aware today about this linkage. So, obesity, we'll start with that one. Um, no, I think I want to start with cancer. Why don't we just talk about cancer first, and then we'll move into obesity because there's a linkage between that too. Cancer. Um, there's so many types, but breast cancer is one that we talk about a lot here on the show. Prostate cancer for something that our men need to be aware of. But tumor infiltrating lymphocytes are linked to TNBC. TNBC. That's triple negative breast cancer. Triple negative. And these infiltrating lymphocytes, these cells, white cells, higher levels of tumor infiltrating lymphocytes in patients who have TNBC. You see, people go to work and they research this stuff every day. And what they have learned is that for those people who have TNBC, triple negative breast cancer, they tend to have higher levels of TILs, tumor infiltrating lymphocytes. Don't worry about it. You're going to, stay with me, and I'm certainly going to keep you um, informed and on the same page with me because I know in medicine we use a whole lot of acronyms. But I'm going to do my very best to break them down so that we understand. Triple negative breast cancer is taking our people out of here. Yes, it occurs more so in Black women. Triple negative. And these particular women who have these higher levels of TILs, um, not treated with systemic therapy, um, correlates with a significantly better survival rate. So if you've been diagnosed with triple negative breast cancer, your doctor may have already tested you for infiltrating lymphocytes. And what the researchers have found is that higher levels of these infiltrating lymphocytes, see, they're white cells. Our white cells are our fighter cells. They fight for us. So the higher numbers of those we have, we tend to have better survival rates. Now, my mind gets to running. I'm a scientist, and I start thinking, well, okay, for those women who don't have high levels of infiltrating lymphocytes, can we give them more? Is there any way to transplant more infiltrating lymphocytes so that they can have better survival rates? You see? That's what scientists do. We ask questions and then we utilize employ the scientific method to study and investigate. And then we observe certain findings and we report on those findings. Sometimes we have to go back to the drawing board when things don't pan out the way we expected them to. But even when they don't pan out the way we expect them to, sometimes stumbling on any finding could potentially be advantageous for us. That's how penicillin was founded. That's how it was discovered. But anyway, investigators found that 5-year distant relapse free survival for stage 1 triple negative breast cancer was 78% among patients with TIL level less than 30%, compared with 94% survival rate for those women who had 50% or greater TILs. Meanwhile, 5-year overall survival was 82% with low TIL levels compared with 95% with the higher TIL level. So, for those of you who have been diagnosed with triple negative breast cancer, ask your doctors if they have not told you already, what's your TIL level? because the higher your level, the better survival rate you most likely will have, the better your prognosis. These findings were published in JAMA, the Journal of American Medical Association. Metabolic syndrome scores. Obesity appears linked to breast cancer. See, I told you. Obesity appears to be linked to breast cancer incidence and mortality. Metabolic syndrome, um, obesity appears to be linked to in different ways to breast cancer incidence and mortality amongst postmenopausal women, according to recent research as well. And investigators found that women with elevated metabolic syndrome had a higher likelihood for developing poor prognosis. Meanwhile, those with obesity exhibited increased odds for having these various receptors. We won't get into them today, but we certainly will explore them um, in future health literacy hours so that we can better understand just what these receptors are all about. But and how that's linked to triple negative breast cancer, right? These findings were published in the journal called Cancer. And just very quickly, just hitting some of these very highlights about some recent research findings regarding breast cancer. Researchers identified 12 breast cancer genes in women of African ancestry. Yeah, 12 breast cancer genes have been identified in women of African ancestry in a very large study. And these may one day help to better predict our risk for the disease. And it highlights the potential risk differences from women of European descent. These new findings are drawn from more than 40,000 women of African ancestry in the U.S., Africa, and Barbados, including 18,034 of them who have already been diagnosed with breast cancer. The findings were published in Nature Genetics. According to Reuters, studies to identify genetic mutations linked with breast cancer previously mainly focused on women of European ancestry. So I'm mighty glad to see that our women are being included more in research studies. And if you hear tell of a great research study, call into the Literacy Hour, share that. And we certainly are going to be sharing various studies because we want women who are at risk for breast cancer or who may have already been diagnosed with breast cancer to join these studies so we can learn more, but also so that you can receive high quality care. American Cancer Society launches a study of cancer in Black women. The risk of dying from cancer has steadily declined in the U.S. over the last few decades, but Black women still have some of the lowest survival rates, and it's unacceptable. While Black women are less likely to be diagnosed with cancer than white women, they are more likely to die of it within 5 years, according to the National Cancer Institute. In an attempt to discover what's driving these stark inequities, the American Cancer Society launched a study called Voices of Black Women. And it plans to enroll more than 100,000 Black women ages 25 to 55 in the U.S. Man, I'm going to enroll. I'm in that number. They say this would make it the largest study of its kind ever conducted in our country. The American Cancer Society is on their job. They want to help find out what's going on, what's driving these health disparities. Listen, health disparities can come down to the neighborhood that you live in. A study has discovered that neighborhood disadvantage is associated with shorter breast cancer specific and overall survival. Women with breast cancer living in the most versus the least disadvantaged neighborhoods had higher risk for breast cancer specific and overall mortality. According to a study utilizing data from the Surveillance, Epidemiology, and End Results study. It's called the SEER 17 study. Anyway, they have a database of 350,824 women with breast cancer. And they looked at these women, followed them from 2013 to 2018. That's 5 years. And again, now, most of these studies that I talk about, they're published in JAMA. And this one was too, JAMA Network Open. But in looking and following these women, they found out that neighborhood disadvantage is associated with shorter survival, greater mortality. You see why we focus on social determinants of health and why it's so important that our community organizations, our faith based institutions be aware, be thoroughly informed. Listen, it's so much more I need to share with you about breast cancer disparities. And I didn't even get to tell you about this linkage between alcohol and cancer. And my time is already up. That's how fast this hour goes. I want you to join me here next Tuesday when we would talk about financial literacy. And boy, do I have something to share with you. Yeah, a new stock just IPO'd. You know how we do it. If you'd like to be a guest on the show anytime, call our foundation, 601-714-8378. Not sure what happened to Mr. Penny today, but I hope he's doing well. I got a note from him. He said, he said he's in a meeting. Oh my gosh, that meeting must have come up out of nowhere. Well, Mr. Penny, thank you so very much. Oh, you're in my meeting. Well, I don't see you. Where are you? Oh, there you are. Mr. Penny, listen, let's take a station break really fast and we'll come back on the other side. I'm sure my producers won't mind. Let's take a quick station break. And we're back. Mr. Penny, I am so glad. Listen, I've been talking about you, man, doing the show, and I'm so glad that you have decided to join me this morning. Right before you come off mute, I do want to highlight that I have been getting several messages from some members of our listening audience. I'm getting emails, I'm getting texts. I'm reading them now, you all. And so, as Mr. Penny prepares to share with us, maybe for the next 5-10 minutes about green leafy vegetables, I want to just highlight a few of these messages. Wow, thank you, Dr. Liddell. We're talking about veggies this morning. Absolutely, you're welcome. The lights on Highway 18 look fantastic. The lights on 18 are great. Wonderful. I've been advocating for it a long time. We still need banks between Walmart. Yeah, absolutely. We still need banks and sit down restaurants. You're right. You're absolutely right, listening audience member. Thank you so much. Listen, without further ado, I do want Mr. Penny to come off mute. And Mr. Penny, welcome to the show, sir. I think that Mr. Penny, good morning, sir.
Yes, good morning.
Oh, we can hear you well. Go ahead.
Okay,
Thank you for
great.
coming in. I've already introduced you, but certainly if you'd like to share anything else with the listening audience in terms of introduction, feel free to do so. They're still chiming in. So again, listening audience member, you don't necessarily have to email or text. You can call in if you like. Mr. Penny and I will be accepting your calls. The phone line is still open, 601-714-8378. Mr. Penny, the floor is yours, sir.
Yes, good morning. Happy to be able to join you this morning. Sorry about the technical issues earlier there. I had sent some messages in, but they didn't get read. But I enjoyed listening to the last 30 minutes of your presentation. So today I wanted to introduce myself. I am the produce specialist for Sysco Corporation in the Jackson, Mississippi area and all the way to the Gulf Coast. So my responsibility is to make sure our sales force is helping our customers, which are restaurants, schools, nursing homes, hospitals, convenience stores, offer healthy alternatives to everything else that you see in restaurants and consume. Produce is a big part of that. The produce category has been growing substantially over the last 10 years because we can now bring produce into areas where it was sometimes hard to do. Produce is grown worldwide now, so it's available to everyone. We grow a lot of produce in the United States and specifically in Mississippi as well. There are some things that we don't grow in Mississippi because of the climate, but we are able to source those from Florida, from Arizona, New Mexico, and California. We do import a lot of produce from South America because of the growing climates. One of the things that we do bring in and have to transport into our area is lettuce. You see lettuce in your grocery stores. You see lettuce in every food service operation. They are all offering some type of leafy green alternative to basically start your meal off. And more retail outlets, grocery stores, are focusing on produce. Most everyone walks through their produce section when they walk through the doors of your grocery stores. They want you to see it, look at it, and buy it. Uh, so a lot of things that people are not aware of, that lettuce, specifically iceberg lettuce, was originated in Mexico.
Hmm.
So it's got its roots in South America, and then they brought it on up and started growing it in your warmer climates of Southern California, Central California, uh, New Mexico, Arizona, and then down in Florida. But predominantly, we get most of our produce in Mississippi from California and Arizona. While our weather is cold here, their weather is the perfect ideal temperature for growing lettuce. It's not too
Mm.
hot, not too cold, so it grows really well this time of the year. So, some of the types of lettuce that you predominantly see and use at home or eat in a restaurant is your iceberg lettuce heads. You may see some what we call value added, where it's already chopped for you. So all you have to do, and we call those ready to eat. So
Great.
they are cleaned and they are ready to open the packages, whether it be a bag or a little plastic carton, and consume that. It's without having to wash it. But all head lettuces need to be washed thoroughly after you peel them, and don't just eat them or put them on a sandwich or something like that. They need to be cleaned, rinsed, and dried with a paper towel. The next type of lettuce that you may see is called green leaf. A little different than iceberg. Most of it is all a light green color. That comes in value added, ready to eat form as well. And then it also comes in heads. And you can take those and pull them apart, rinse them, and then further chop them for your salad or whatever you may be adding them to. The third one is your romaine lettuce. That is a specialty type lettuce that you will see. Most what we see in Mississippi in retail is value added, ready to eat. It's already been cleaned and pulled apart and chopped to make maybe a Caesar salad with. But there again, with all lettuces, whole fresh lettuces, um, you need to pull them apart and clean them thoroughly before you eat it, to make sure that it's clean and ready to go. Um, so those are really the three types of lettuce that what we predominantly see in retail, food service, hospitality, and healthcare in the state of Mississippi. That they're the most economical for us to serve, so that people can afford it. This year, unfortunately, to say, it's been a little bit of a rough year for growing lettuce. due to some of the climate changes in the growing areas, getting a later start because of some warmer weather. So it's caused a high demand and it's caused the price to be increased substantially. So we at Cisco, we are the largest produce distributor in America, and we are trying to work with our suppliers to grow more, to keep more on hand, so that it does keep the cost down for all of our consumers, not just our retail consumers, but our restaurant consumers, so that they can offer inexpensive alternatives to all of the other things that they may offer. So
Wow.
yes, ma'am, we're trying to do our part, and my responsibility is to try to educate people on the use of produce and the different ways they can use it, and and it starts really with our children. We have to introduce this to them at an early age so they will develop a taste for it, and show them the different ways that they can eat a salad. They can top it with just about anything, especially healthy proteins, fruits, other vegetables, and then maybe a low calorie, low fat dressing just to give it a little flavor. And they may be more susceptible to eating it versus just saying, no, I don't like that. So,
Oh, wow. Listen, I'm so happy that you are our guest this morning, Mr. David Penny. And for those of you just tuning in, yes, we are taking a few extra minutes over our time. You can always log into our YouTube station and listen to this portion if your radio station has already gone off. But Mr. Penny is a produce expert, you all. He works at Cisco. And for those of you who do not know, he mentioned it, but I'm going to say it again. Cisco is the global leader. Listen at what I said now. I said global leader, not just local, statewide, countrywide, but global leader in selling, marketing, and distributing food and non food products to restaurants, healthcare facilities, educational facilities, lodging establishments, and customers all around the world. And what makes me so happy about it is that Cisco got its start right here, Mr. Penny, in Jackson. How inspirational is that?
that is correct.
Well, I heard another business owner say something like, we could have never imagined that a company as big as Cisco would treat us like the family we have become. Well, I, Dr. Kentrell Liddell, CEO of Test Taking Solution, founder of the Test Taking Solution Foundation, do hereby confirm and decree, and I want to go on record as doing such, that what that business owner said is absolutely true. Test Taking Solutions is very grateful for our account manager over at Cisco, Mr. Navakias Pinkwhite, and his colleague and supervisor, Mr. Wardell Jackson. Those gentlemen are workhorses, Mr. Penny, and they told me all about you, and they really care about their customers' success. Now, I want to thank you, Mr. Penny, but looks like we've been getting some questions, sir. You want to take some of these because I'll read them off to you.
Sure, go ahead.
All right. Someone said, ask Mr. Penny to please list off those three types of lettuces again. Go, Mr. Penny.
Okay, iceberg lettuce, green leaf lettuce, and romaine lettuce are your top three head lettuces grown in America.
Thank you. Hope you got that, caller. And again, don't be shy. If you want to call in and talk to me, you can. But I know you guys are so respectful. Thank you so much. You know that we're pressed here for time, and you've sent these in as Mr. Penny was talking. I really do appreciate it. Let's see here. And if I don't get a chance to read your question on air, please don't hesitate to send me an email, and I will follow up with it and copy Mr. Penny and get you guys connected, because we want you to be informed. We want you to be educated. So thank you for posing these questions. Someone asked, which category does romaine lettuce fall in? Okay, as you heard Mr. Penny say, romaine is in a category all by itself. Is that right, Mr. Penny?
It is. It's a separate head lettuce. It is considered under the lettuce family, but it is a separate lettuce. It looks different. It's shaped different, but it basically eats the same way. It is a green leafy lettuce, and meant to be consumed raw. Some dishes you can cook a little bit with romaine, as some chefs may do, but most people prefer it to eat it in a salad as raw.
Wonderful. This particular audience member said, Mr. Penny said that we should wash our lettuce, Dr. Liddell, but he didn't say how. So, should we use soap, warm soap and water, just a little bit, or just water? Okay, that's a fair question, and I'm glad you asked it. Listen, everyone, no question is a dumb question. Someone else may have that same question. Mr. Penny, you want to take that one, sir?
Yes, I do. So you should just use clean, clear, cold water to thoroughly rinse and just lightly scrub the leaves a little bit, just to remove anything that may be on there. Most people don't know that, and I'd failed to mention this, that at Cisco we harvest all of our lettuces right from the field, so you're getting it as fresh as it can be. We contract with large farms in these growing areas. We have standards that we expect them to meet as far as color, sizing, um, and anything else that goes along with it. But it is cut right from the field, and it is packed right in the field. So it is not, it has not been cleaned at all, other than rain that they may occasionally get, but they don't get much. They irrigate most of that to get it growing. So there could be a little dirt in it from the roads around the farms in it, and things that need to be just lightly rinsed, and then it's ready to eat.
Oh man, that's just excellent education, Mr. Penny. Thank you. And you know what? You guys, y'all have done such a marvelous job. I'm gonna take one more here. And caller, please forgive me. I hope that I get this one right. You said, should we dip our lettuce in the salad dressing or should we pour the dressing over the lettuce? I have heard about both. Okay. I think I know what you're asking. You're asking about that salad dressing, whether or not we need to dip, okay, get our salads on the fork and just dip it in the dressing, or whether it's healthier or better to pour the dressing over the salad. And okay, okay, thank you. Someone said that's right. All right, Mr. Penny.
Well, that could be a personal preference. I can say that my wife is one of those that she gets her salad, she puts her dressing on the side in maybe a little dish, and she dips her fork in her dressing if it's a thicker dressing like a ranch or Thousand Island, and then she puts it in her and picks up a fork of her salad and eats it. So she feels like she's not getting just a salad with just covered with ranch dressing, and you end up getting more dressing than you do salad. But you can do otherwise. Just keep in mind that your salad dressing is an additive, and depending on the type of it could contain a lot of sugar. It could contain a lot of fat in it that we may not be eating. So eat it sparingly, and enjoy the toppings that you put on your salads, like your cucumbers, your tomatoes, your shredded carrots, and anything else that you can add. You can add just about anything to a salad. Check out some of your larger buffets, such as like Golden Corral, that offer a big, huge salad bar with many different items you can add to it, and then at the end add a little bit of dressing on it for a little additional flavor.
Well, Mr. Penny, you are so right about that. And you didn't name mine. My favorite is the raisins. Man, we created a salad bar for our scholars during spring break. And listening audience, you would be amazed to know that the children wanted seconds and thirds. They really enjoyed fixing their salads and adding those toppings, especially the cucumbers and the tomatoes. So encourage your youth, your children, to eat healthier this year. Okay. We want to add some leafy green veggies to our diet. We look forward to learning more from Mr. David Penny. I almost called him doctor, and then, well, shoot, my goodness, with all of his experience and expertise, he could be. But I know you have doctors in the house. Is that right? Don't you? Isn't your daughter or is someone a pediatrician,
Yes,
Mr.
yes.
Penny?
My daughter is a pediatrician. She's a graduate of University of Mississippi, and then of also the uh, graduate of the school over in Clinton, and I've gone blank on the name of it there. So she
Mississippi
is a
College.
Mississippi College, and then she went on to medical school in the island of St. Martin down in the Caribbean. And then she came back and finished her rotations in the New York area, and now she's a practicing pediatrician in Gainesville, Florida, with her husband and two children.
Oh wow, that's so special. So yes, you are all about the youth, and obviously did a great job of raising your own children. And so we thank you so much for the education that you rendered this morning. Sorry about the technical difficulties at the beginning getting you connected, but we won't have those going forward because we're going to hear from Mr. Penny again this month. You all month long. Our theme is healthy nutrition. And so January 21st, we're going to hear from Mr. Penny. He's going to tell us about fruits and their skins. Yeah. And on the 28th, he's going to share, well, in his own way, but he may very well talk to us about some of these seasonings that we're putting on our food, including herbs. All right. Any final words, Mr. Penny, for our listening audience?
I think that's going to about do it for today. Thank you again for allowing me to join your call today, and hopefully someone will go out later today or throughout this week and maybe stop and introduce a salad to their children.
Oh, wow. Thank you so much. And thank you also, listener. I see your comment. Processed food supply negatively affects our health. Thank Mr. Penny for visiting with us today. That is so nice of you. Thank you all so much. Y'all are amazing. All right, Mr. Penny, we're out of here, sir. We're out of time. We'll be back together again next Tuesday. Enjoy the rest of your day, everyone. For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream at affiliate stations.